to be teaching you guys about proper ergodynamics for ultrasound technicians, sonographers. MSK injuries are very common within the first 5 years of scanning, which is really bad because then a lot of these techs can't continue scanning and continue their job. And the ultimate goal is to be able to do this job for as long as you can with minimal pain. So what is an MSK injury anyways? It's a musculoskeletal disorder that a lot of sonographers get when they're scanning, and it usually happens between the 3 to 5 years of scanning. That is no time at all. The most common areas that you'll see sonographers ache in are your shoulders and your arms, your wrists, and overall these techniques will help these areas in your arm and even your back. Overall, the goal is to continue scanning for as long as possible, and today some of these tips and tricks will help you not get an MSK injury or at least prevent very major injuries so you can continue to keep scanning. For patient positioning, your patient should be laying down as close to you as possible. So for example, this would be way too far because when I am scanning Megan right here, my arm is really extended out and I can't place my arm anywhere. So Megan, come closer. This is way better for your arm and your shoulders and your wrists because you're not straining or overreaching anywhere. Your back is nice and you can see the screen and everything. Ergonomic scanning techniques can include having both feet firmly placed on the ground at all times when you're scanning. For example, like this. A bad example would be if you're raised up really high. Even though you're raised up high with the machine and the patient, your body is not ergonomic. So you're gonna have some problems. So making sure that all of the things are equal and your legs are on the ground and that you're not hunched over and you're like no slouching. Because if you're slouching all the time with your patients, you're gonna have some strain in your back and in your neck, and you're not gonna wanna do that for much longer. So I know it's hard to get used to, like some good posture, but if you can get it there and you can keep good posture, your back will thank you. For this, the patient is way too far away from me, and when I'm scanning her, I will have to use a lot of reach on my shoulders and on my arms. For example, doing all of this is straining my arm and my shoulder, which is not good, and you can have an MSK injury from that. Megan, come closer. Just asking a patient to come closer to you if and when they can. It will not always be available to you, but if they can, if your patient is physically able to, ask them to come closer to you, and that will help your shoulder, your wrist, and your arm from not overextending and overreaching, when you really can just stay right here and you can stand in your little triangle and you're not straining any of your muscles. Another important ergonomic is how our machine is set up to us and the patient. Right now, what's wrong with this? This machine is, yes, faced towards the patient, but do you know how much space that I'm wasting? I can't be right here because then I can't see my screen or touch any of my toggles. So it's important that before you get your patient here, that your machine is set up perfectly so that we are scanning as ergonomically as possible. Putting it down, having our screen face toward us, and we have this triangle. Another scanning technique that you can use when you're scanning is to rest your arm and your forearm on the patient if you're able and if you're comfortable enough to do so. This way you're not like kind of reaching your arm up or holding your arm up and using all of those muscles for no reason. And also it's gonna be harder for you to apply pressure for abdomen exams if your arm is raised in the air. So keeping it on the patient when and if you can will help you not get a shoulder injury or a wrist injury. Sometimes when you're working and scanning, you will have to be standing. It's important that you understand the rules and the ergonomics of this. So right now I'm gonna slowly raise up our patient, Megan. Are you okay with getting raised up today?
Yes, ma'am, I am.
Awesome. Okay. And as you can tell, I cannot scan like this now because now I'm overreaching. So what we're gonna have to do is stand up and raise our patient as much as we can for us. This also includes moving the machine up to better fit this triangle again. And now when I'm scanning, I'm not reaching over, I'm not really down low, I'm perfectly in this triangle, and I'm not overreaching or stretching out my muscles for anything. It's very important that we scan with the perfect ergonomics with our body positioning and patient positioning and machine equipment so that we can scan for as long as possible. And don't be scared, there are gonna be some times when you're scanning patients, whether it be in the ICU or ER, and you can't keep all of these things perfect. Just do it as long as you can and if you're able to. And now, after you're done scanning your patient, it's important that you tell them, okay, I'm gonna raise you down now, okay? Your patient should not be getting up from this at this high level. It should be lowered completely, and then they can get up for safety reasons and to protect yourself. All right, you can get up now. Exercise time. Grab your stretch band. This is so important. You can do it before scanning, after scanning, during break, after your walk-in break, just to kind of get some stretches in at your job. This is called the inferior shoulder stretch. Elbows at side, forearms up, palms up, like this. And this will help really extend those muscles in there. And then you can do the same thing in the back. Helps your abductor, back muscles. This. I just heard a pop, so that's probably good, right? Because you're probably tight. All right. Thank you, and make sure that you apply these stretches on your daily life as a stenographer. That way you can scan as long as possible with no pain. Using all of these tips and tricks that I showed you while you're scanning can help you not only be a better stenographer, but be able to perform your job for a longer period of time. So overall, keeping your patient close to you in the machine at the perfect angle, also keeping your feet planted on the ground with good posture and not overreaching or overextending your arms at anything over the 30-degree angle, these all can help you prevent an MSK injury. Again, with the overall goal of you not getting an MSK injury in your first 5 years of becoming a stenographer. You didn't go to school for all that time just to injure your arm, did you? Along with being able to scan for longer than 5 years, just think about your everyday life. If you're scanning very hunched over and your arms overextended, you're not going to be able to, say, play basketball, run around. If you have any kids, pick them up, because your arm is going to be hurting constantly. So it's important that you think about not only your work, how your work is going to be, but also how your personal life is going to play out if you get an MSK injury. It's important to note that yes, preventing an MSK injury is very important to stenographers while getting perfect images. But it's also important to think about how that will affect you at your day-to-day life. You will have problems picking up things, reaching for things, cleaning, cooking, basically everything if you have a shoulder, wrist, hand injury. If you start using these tips and tricks now as a young stenographer, then it'll be easier for you to keep up with them the longer you go on. And starting at the earliest point possible is very important for these MSK injuries. Happy scanning!